Hello, and welcome to the Tai Chi for Therapists podcasts, where we explore the evidence and practice of Tai Chi and qigong in clinical settings. Welcome to episode 2. I'm Helen Parsons.
And I'm Philip Sheridan. And on today's show, we have Charlotte Rondel, an occupational therapist based in Jersey. Welcome, Charlotte.
Hello.
Thank you for joining us. In order to get us started, could you tell us a little bit about your role and your setting where you practice?
I work in a primary care mental health team. The primary care mental health team in Jersey, there's only 3 clinicians on my team, and the other 2 clinicians are nurses. It's not, the system isn't set up like it is in the UK. We're not based in GP practices and assigned to GPs. The way the mental health service is structured here is that GPs will refer people, or people self-refer actually, for mental health assessment, reaching out, identifying that need for mental health support or intervention, and the team assessing the person may see they benefit from talking therapies, they may have some other difficulties or short-term goals where the waiting list for talking therapies is quite long here. They can refer to our team for 6 to 8 sessions of more focused work on specific difficulties or interruptions that they're experiencing because of what's happening to them at the moment. We tend to see people that, I see people of over the age of 18 right through to people in the 90s. And it tends to be people that have been living with anxiety, difficulty with their mood, or depression for many years. It's quite often precipitating factors, and on top of the predisposing and perhaps a new trauma or a life event that has meant that the way they were coping before, or their existing coping mechanisms are quite good enough, and they're needing a bit more all of a sudden. We just work with them to problem solve and to do some low level CBT as well without delving too deep, where they they need to feel safe, and they'll be perhaps waiting for or going ahead into more in-depth talking therapies in the future. So yeah, that's my caseload.
Thank you. Thanks so much for explaining that and the differences, out there in Jersey. It's a beautiful part of the world that you've got there. And so we just had a little chat before, and we were finding out about what sparked your interest in Tai Chi and qigong, and you were telling us it's been in the back of your mind for a while.
Yeah, I've always been impressed by the grace and control that I've seen people practicing the movements with, and it's something I've always appreciated being physically active, and I'm somebody that I feel I didn't say this before, did I? But it's going to come out odd. But in control, like if I want to run, I'm coordinated. I'm quite smooth with how I move, because I've been used to doing lots of different types of exercise, and I like high impact activity. But I imagine that when I'm older, I wouldn't be able to do that so much. And I always imagine I'd do Tai Chi into older age. It's something I wouldn't stop doing once I started. So it was on my radar, but it wasn't something I was actively pursuing at this point. And I did your course a couple of years ago now, and it was just because I was already interested. I saw the advert in OT News, and I thought, well, actually, now's an excuse to start. I can do it now, and I start integrating into my clinical practice. And I knew that it was something that I was already interested in, so that was probably going to help me. It's good for us to do things we're interested in. So that was it, really.
Fantastic, thanks. That's a really interesting explanation of why you were drawn to it and how it appealed to you, and how it's appealed to that real felt sense of what it's like to do an activity. And how you also were describing to us just before about how it felt like it was a really good fit for OT, just the general OT toolbox. Could you say a bit more about that for us?
Yes, I mentioned I wasn't thinking about the client group that I'm working with currently as the only client group I would be using Tai Chi with, because I appreciate as an OT, I expect to work in different clinical areas, and I've worked in physical health before as well, and that I'll continue to move. I just I know that I can use it with any client group within reason, because Tai Chi is holistic in its own nature. It's a really good fit with occupational therapy, where medicine is becoming more specialized, and then we can actually strip it back again and focus on interconnections with the body systems. And it really just, that philosophy of Tai Chi really speaks to me as an OT, and yeah, so it's not in conflict with my own beliefs, really. It's a good fit.
Could you say a little bit more about that kind of fit between Tai Chi philosophy and occupational therapy a little bit?
Yeah, so we consider the whole person, don't we, as occupational therapists, and Tai Chi appreciates that the person isn't just a physical. It's how the mind and the body work together, and how they're connected, and how the systems are connected with each other, and the emphasis as well on prevention. So looking at traditional Chinese health and medicine, the emphasis being on prevention, and when we look at somebody holistically, and we can have a positive impact in one area and know that will have a positive knock-on effect in another area. Just knowing that and believing that, the two practices, Tai Chi and OT, really do align quite well, I think.
Yeah, I agree. I consider myself something of an honorary
OT.
honorary OT, because I agree with you. I really think there is a good alignment between that underlying philosophy within Tai Chi and those underlying principles that inform OT practice as well. So yeah, I think you're absolutely right, Charlotte.
Yeah, we've kind of had the discussion around sort of very much it also, like you say, it combines the whole person, and it really understands the process, the doing, like you were saying before, the activity. It is a really key part of OT, isn't it? The doing part. And, obviously, it really is about the practice. When we do our Tai Chi, we really have to practice it. We really have to embody it. And I think those things are really key, aren't they?
Yeah. So you did our course.
Yeah.
Did you begin implementing sort of Tai Chi into your practice straight away, or did it take a little while for you to kind of get there?
So I started on the staff, actually. My team, when I first started practicing, I was part of a larger team, the older adults mental health team. So I had more of a captive audience, and I started wellbeing sessions for the team once a week, and it gave me an opportunity to practice there. And then with patients, the opportunities came really doing it one-to-one with people, using the H-Transblocade and working practice of those movements into home visits, where when I'd be working with the person, what they were explaining to me, or the problems we knew they had, or difficulties they were trying to work on, and if I felt that there could be an interest there as well, I could basically sell it to them. Well, you could try this movement and that movement, and we go through it together and get their initial reaction. And it basically is complementary to whatever else it was I was there for. That's how I started implementing it, basically, and watching other people copying me practice the movements, getting to see how I like to explain them, the cues. But of course, a lot of them just taken straight from how you like to explain them, because it's really, really accessible. And then just developing my own style.
Mm.
It's something I've not ever had difficulty with, anyway, because I have done fitness instructor qualifications in the past and used to teaching exercise. I just haven't done it for a while.
So you have that as a good foundation for or kind of working with groups of people as well.
Yeah.
Fab.
Yeah. Brilliant. Really lovely explanation there. And I think that's come up with other people that have done our courses. They said they've actually used it on colleagues first, or plan to use it with colleagues first as staff well-being. And I think that just again shows the versatility of Tai Chi, doesn't it? That it's not just a rehab modality, it's therefore as a wellness modality as well. I think it's is really interesting.
Yeah, it's not like a home exercise program. But it can be actually delivered as a home exercise program. It's very versatile in that sense. It's a mainstream activity with a presence that people know. Most people have heard of Tai Chi, but not qigong. And so you can get buy-in through that curiosity, and then you get people sold on it when they can do movements that suit them, and then they can experience, because you can experience the positive benefits immediately, the active relaxation, and the sense of that social support as well when you're doing it, because it's always at least with one other person. And when you start teaching the person, and that sense of all that they can do something that feels good, perhaps at a time when other things don't. So yeah, it's not a difficult type of movement therapy to sell, basically.
Excellent. It's a really fantastic description you gave there, of a really portable practice. You were saying you can take it straight into people's homes, introduce it quite quickly. People already have a positive beliefs about it. They've heard negative things in the media about it, and you can straight away kind of show them a little bit and get them to try it out. I think that was a lovely description you did.
It was, yeah.
So in terms of, have you, I believe you've gone on to do like community groups not community groups, but a group situation as well. Was that difficult to set up? Did you have to, was it a challenge to kind of get the resources together, to hire rooms, etc.? The practical logistics difficult, or was that quite a quick setup?
In short, yes, a quick setup, because I've kept it within my clinical practice and within my working hours for my client groups. But what I've also been able to do, I've been able to branch out across the mental health service here and offer a group to the secondary mental health service within the day service, the day centre, for want of a better word, where people come along who, if they're under the community mental health team, which is the step up, if you like, from my team. And they're referred to this day service, then that is a captive audience as well, and a space for me to do the session. And I've also been reaching into the inpatient ward and doing sessions with the older adult ward and also the working age adult ward. But their spaces have been adapted recently, and actually now I'm able to teach them both in the same space. So it means that where I was alternating my weeks and doing 1 week with the older adults and 1 week with the working age, we've merged the two sessions now, so that as long as I keep going up there, I can see anybody that wants to do Tai Chi practice each time I go. So yeah, that's how it is at the moment. So that's technically 3 sessions a week I'm doing at the moment, but I know that that situation will evolve and change with my own clinical practice and where my caseload is. I haven't branched out yet into doing an independent class or looking at working independently outside of working hours. That is definitely beyond my capabilities at the moment.
But it's fascinating, isn't it? All the different ways that Tai Chi can be used, the different, like saying, the flexibility to be used across the settings, and you're just able to take it with you.
Yeah.
And age groups. And if it's there on the sidelines, should you want to at some point in the future, you kind of got that idea that maybe you might venture out into bit of independent practice with it as well. So for me, I kind of think you've done an amazing job there of summarising the sort of the different ways in mental health they can use it. Can you tell us about sort of the reactions from patients or colleagues about introducing this? Any sort of standout ones for you?
Yeah, so colleague reactions have been really positive, and they've been supportive as well in within their own caseloads, that at any people that they're working with that they see could benefit, and then they give me a bit of an insight into the person, and say, do you think they could come along? And my answer is always yes. So yeah, my colleagues are supportive they're showing that support by referring their clients to me as well, and within the day centre and the inpatient service as well, helping me to facilitate those sessions, and help to remind people when they're happening. So sort of practical support in that sense. The reactions from the different clients, my primary care clients are really sort of, I think it helps me to look at the 8 active ingredients. I've reflected on this a bit, and probably the embodied spirituality, even though I haven't covered it specifically yet. I'm thinking, when I was reflecting for this podcast, that's something I'm going to try to ask my participants a bit more about going forward. But just that they feel more connected with themselves and what they're trying to do for themselves in everyday life. So they know that they're coming along to the session and they're looking after themselves by attending, and they take that away with them and thinking about how else they can support their well-being, and with that intention as well. The primary care clients are also, I think, a little bit more open to using visualization, and I guess they are perhaps sometimes functioning slightly cognitively slightly higher, and it's meant that we can get a bit more technical with structure and posture as well. So because that's increasing the cognitive load as well for them. So that my primary care group is definitely the group where we've delved a bit deeper. If we broke down the 8 active ingredients, I've covered more within those sessions. I feel with the secondary service clients, the emphasis has been on active relaxation and awareness, definitely, and that's social support. It feels a lot more supportive and inclusive in those sessions, and everybody has. You can see how everyone relaxes, and they're very fun as well, those sessions. With the day service participants, it's the only group I've tried this with so far. I give them a scale. They can do it in their head now. They don't have to jot it down because they're used to me asking it. But just their own perception of what mood means to them and their own mood, without being prescriptive. On a scale of 1 to 10, where are they, with 10 being as happy as they can be? Where are they on the scale at the beginning of the session, and then to rate again at the end, and that, as well as being able to say, well, your mood has improved, because it usually does. I say always, it usually does. People tend to, if they don't go up 1 or 2 on their scale, they will just stay at the same number. So it's either the same number or up 1 or 2, and that's been consistent. So that's been really nice to see. But it's also supporting them to be aware and fostering that awareness, which I think they find, certainly the people I'm working with, find it really difficult sometimes. So that's been working quite well in that group.
So really, Sorry.
Positive reactions everywhere in lots of different ways. Yeah.
That's a fab description, Charlotte. And again, a really lovely use of a very simple kind of outcome measure of just using a very simple scale of 1 to 10. Do you use any other formal sort of outcome measures to keep managers happy or anything like that? Or have you got a certain amount of autonomy there and you can use, as you say, something that really relates nicely to your patient group?
Yeah, I think the latter. I do have a lot of autonomy with it. At the moment, I know that I need the administration and the facilitating role for me to be as straightforward as possible because of the other tasks I have within my role. We use the model of human occupation, and we're trying to, as a wider mental health service, integrate MOHO more into our everyday practice, the assessments, and also as outcome measures. The service outcome measures we use are not appropriate for me to ask people at the beginning and end of a Tai Chi session. So I wanted something that I could get a quick snapshot. But seeing as it's been received quite well with the secondary clients, I could use it with my primary care clients as well. The managers haven't asked me for more at this point.
That's okay.
That's good. That's always a good position to be in, isn't it? Not asking too much yet. I just wanted to quickly go back and reflect on your description of picking out the 8 active ingredients. So just for people that may be listening to the podcast and haven't heard the 8 active ingredients before, that was a model created by Wayne and First, and you can find that in the Peter Wayne book, Tai Chi, the Harvard Guide to Tai Chi. And it's a lovely description, isn't it? I think it gives us as allied health professionals little ingredients to go in, and we can, like you say, you gave a great description there of looking at embodied spirituality to really help people reflect on their own motivations about why they might be taking part in it, so they can make it personally meaningful to them to kind of reflect on that. And you also mentioned the active relaxation. That's one of the active ingredients. And I think those are things we might already be using as OTs. It just happens to fit nicely. It layers really nicely, doesn't it, with the 8 active ingredients? So we don't have to be bolting something very artificially on. It's already kind of inbuilt there, isn't it, for us? And we're just kind of flexing those different ingredients or mixing them slightly differently.
Yeah, exactly. And using them purposefully to help. It's a good way of checking in. Okay, what are we creating in this session today? Are we emphasizing these different ingredients? And where you realize, perhaps we could emphasize one a bit more. So strength and flexibility, just reminding myself there, just prompting people if I can see that it's not too much to ask, say maybe you can consider your stance. You want to try and take a slightly deeper stance, and encourage your knees to bend, or maybe do some work in some weight transfer, some clock stepping into a session where we're doing a lot of the 8 strands of brocade and breaking it up that way, so that we are working on the lower body as well as the upper body. Intention fitted all the way through. It can just quite simply be focusing on releasing muscle tension. So encouraging the shoulders to drop, and I can repeat that so many different ways, so many times in one session, because the shoulders do keep creeping up. So that's just a simple take on intention, another one of the ingredients. So yeah, it's not difficult to focus on them and integrate them into sessions.
That's a great description. Again, sounds very similar to our sessions, Charlotte, where again, we'll often be circling back to very familiar cues to help people actively relax, for instance, and use that intention as well. Have you had any sort of unexpected outcomes, anything that you weren't necessarily kind of looking for that maybe took you by surprise, or a bit of feedback from a client that suddenly made you think, oh gosh, that's interesting?
Oh, the one that comes to mind, but this isn't like a revelationary one, but just when a lady came back 1 week after, I think she'd been doing sessions with me for about 5 or 6 weeks, and she said, "Oh, I found myself in the kitchen when I was making a cup of tea, and I was noticing how I was shifting my weight from one leg to the other, and I was being really aware of how I was moving myself." And she was basically confirming, "Yes, I see what you mean now when you refer to this in the class." So it was sinking in for her, and yeah, without any prompting, it was something she mentioned at the beginning of a session. So that was really nice. I really enjoyed hearing that bit of feedback. It was for her, but it was also feedback for me. I took that as well. That's one of the positive outcomes of the teaching and of what we emphasize when we're teaching. So it's nice.
Yeah.
And all credit to you as well. It's, obviously you kind of communicated that effectively in your sessions, and that became something that became part of her daily tasks. And it chimes with when we read the research and studies around Tai Chi for different kind of populations, but Tai Chi is often described as a moving meditation, or sometimes it's called mindful movement. I was just thinking then, as you described that piece of feedback, that's exactly what that lady was engaged in, a little bit of mindful movement, even though she was engaged in some activities of daily living.
Yeah, and she is somebody that is she's in her late 70s, so she's into that category of the over 65s where a third will fall every year, and it's something that is really, there's some really scary statistics with falling and the cost of falling, and Tai Chi and qigong are practices that you just want everyone to do it. You just want everyone to do it.
Yeah, it's a lovely circling back there to come back almost to the beginning to kind of talk about, this is a whole practice, isn't it? Even though they might have entered a mental health service, it doesn't mean we can't be working on other aspects and helping them, facing older age. We know we want them to be as strong as possible. We want them to be working actively on their balance, to maintain their balances, if they're living independently on the community. It's all beneficial stuff that we can be adding in there. You're just getting extra bang for your buck, as we sometimes say. So you just do want everybody to be doing it. It's fantastic. We just want to kind of, as we're coming towards the end, sort of any reflections or anything that any top tips that you would like to share with any reflections that you've had on your practice from the start, things that you might do differently, or just things that you think, I did that well, perhaps I'd like to share that top tip with somebody else who's thinking about starting.
I think that it's really important to practice for yourself. It's really hard to find the time when you don't have another excuse to do it. But yes, it really helps to be confident in performing the movements. So I know it probably goes without saying, but when you're confident and smooth with how you demonstrate the movement, people will be confident in following you, but also they get a sense of what you are trying to create, that mindful movement and the acts of relaxation. They sense it from you. So if you are proficient and smooth in your movement, it is felt by the people copying you, participating with you. It's basically giving a really good example to follow. With that, I do get really frustrated when people don't go at the same speed as me. And that's something that I have to reconcile with a lot. So especially when you're verbally cueing as well, you don't pick on individuals, don't ever pick on individuals unless it's it's in a context of something funny that's happened and they invite it. But when you say to people, I'm slow down the movement and try to follow my speed or whatever, and then they don't seem to respond to that cue, they're still doing it fast, and it does puzzle you. You think you don't know what to do with it in that moment, but obviously you just keep on practicing, keep on, because the person is getting a lot from it, even if it's not what you are intending, what your initial intention is. Yes, even those individuals that I'm surprised that they're going faster, and then they're sort of stopping and waiting for me, and then carrying on again, or looking around a bit, and then coming back to the movement. They'll still say to me, I found that really relaxing, thank you. I really enjoyed that session. So yeah, I just I reconcile with that quite a lot. It sounds like I'm being a perfectionist with it. I'm not. It's just yeah.
No, I think that's a really good point that you bring up, because I think a lot of times we think the Tai Chi that we have to be doing, or our people that we're working with, has to be perfect. That we've just been discussing ableism and how that might inform our practice sometimes, in terms of we're expecting perfection, or we're expecting it to look a certain way. And while we know we can encourage certain aspects, does it have to be perfect to have the benefits? And absolutely no. Like you say, somebody can be going at what's slow for them and still be feeling some relaxation. And when we that's really interesting. So so we've not to dismiss how somebody's doing it is what, and how they're feeling the benefits.
I think for me that's a constant aspect from our workshops and classes with people, Charlotte, is we will have maybe one or two individuals within every session and with every group who you're like, are they getting a benefit from this? And because it doesn't look like they are, because as you say, they might be going rather quicker than we might prefer, or their face just doesn't give it away, or their non-verbal communication looks like they're somewhat angry. But as you say, at the end they go, I found that really relaxing, as I really enjoy coming to these sessions. And sometimes there's this kind of incongruous kind of messaging that's going on non-verbally between us as well, isn't it? And Helen makes a great point there, is that we can't assume how people are perceiving this, unless we ask them, and unless we do actually get some feedback.
Yeah, and I've taken a lot of confidence from that, from recognizing that that's okay if people are interpreting what I'm doing differently. I can I can check in with people, understanding generally whatever it is I'm trying to show them. So, I can adapt my language or adapt my style if I need to, but then otherwise just roll with it and be consistent. Make sure that I'm teaching it in the most accessible way that I can think of at the time. And then, it's not all, the rest isn't in our control, and it's okay. So that's actually helped my confidence as well.
Great. I think there's a really good, excellent top tips to pass on to people that are interested in this and thinking about how they're going to apply it in their setting. Really, really important.
I think they're
points.
really apt for the mental health aspect. I like the way that you said it's okay. And again, I think sometimes that's actually a really important message for people to hear, but also tacitly embody through movement, that it's okay to be me. It's okay for me to inhabit my world and my body in this way at this moment in time, and maybe recognize that might change over time. And it's okay. And I think sometimes that very simple message can be really quite profound.
Yeah. One thing as well, it just reminded me of is because I'm mindful of, I don't know everybody's backgrounds, people that I'm working with. And we've talked about being trauma informed. That's something I try to be aware of all the time when I'm working with people. It's hard, but we do try to be. And I've been just trying to work on how is the best way to cue movements, and particularly when it comes to center and our center of gravity being between our hips, for instance. So again, when I'm cueing people and hoping that the language is accessible enough, but also doing it in a trauma-informed way, seeing that I don't go too away from the point by saying middle or waist, or if it's a group where I've learned that they're okay with the word center, then we'll keep using center and make sure they know what that is. But that is also part of it. And then once I know, okay, well, I know they understand this word, and I cue it. And then if they're moving in a different way, or they're moving in a way they interpret it, I know we've already covered it, and I know that I'm using words that they're comfortable with. And so the rest is just how they like to do the movement.
That's a super important point, is using language that connects with your patient or with your patient group as well. Such an important point. That makes all the difference.
Yeah, providing that psychologically safe space, as they say, isn't it? For people then to get all the other benefits, the active relaxation when they're given permission to do what they want to do, to be who they want to be in the session. So that's a wonderful point. I feel that we're kind of drawn towards the end. So I don't know if there's anything else you want to add to that before we finish. It's been a fantastic conversation. You've brought up so much.
Thank you. Nice to talk.
Thank you so much for joining us, Charlotte. It's been fascinating. And if people want to find out more about your settings, is there a setting, is there a website for your trust where they could find out more about it? Or
so we don't have a separate website. It will be part of the Government of Jersey website, which is www.gov.je, as in gov.je. And the mental health service can be searched through that. But really, it's probably easiest just to email me, because there isn't anything specific enough on the website. So they can email me. It's fine.
Fantastic. Thank you. We'll have your email contacts then at the end of in the podcast notes. So thank you so much again for joining us, Charlotte, and sharing all your knowledge and learning on the Tai Chi journey. And we wish you all the best with your ongoing journey.
Yeah, thank you, Charlotte. It's been lovely to chat with you. Thank you so much. And we will no doubt see you again in another guise, because you do like to pop back onto our audience on the live sessions from time to time.
Being able to drop into those live sessions is so beneficial, and it helps you to feel connected and included. And I do take more away each time. I always take away something new, new ideas. So I appreciate being able to do that.
Brilliant. Thank you so much. It's always a joy to have you in the sessions. And as we're kind of learning from each other on this journey as we carry on. So thank you so much again, Charlotte.
You've been listening to a Tai Chi for Therapists podcast. If you'd like to find out more about our course aimed at rehabilitation professionals called Tai Chi for Therapists, then please visit our website at www.discovertaichi.uk.